Hello, I'm Tim Lloyd, consultant oral and maxillofacial surgeon. Wisdom teeth can be a real problem. They're sometimes termed as third molars, and they come through into the mouth and erupt at about 17 or 18 years of age. Sometimes our jaws are too small to accommodate the wisdom teeth, and there isn't enough room for them to erupt. They may come through into the mouth partially, and this is called partial eruption. Unfortunately, a gum flap often lies over the top of the crown of the wisdom tooth, and food and debris can be caught in this area and cause recurrent infection. This can be quite uncomfortable and often requires antibiotic treatment. The incidence of impacted wisdom teeth is in the region of 70% of the population. Not all impacted wisdom teeth cause problems though. The International Institute for Clinical Excellence advises that wisdom teeth should be removed if you have more than one bout of infection associated with the tooth. Removing impacted wisdom teeth is a surgical procedure and can be done under local anaesthetic with sedation, or under short day case anaesthesia. It is really patient preference and difficulty of the teeth that will determine the way that the teeth are removed. At the London Craniofacial unit, which is based at 152 Harley Street, we have all the necessary resources both to assess the wisdom teeth. We have a modern 3D cone beam CT scanner which will tell us the position of the tooth and its relationship to a nerve that runs through the lower jawbone that can be injured when wisdom teeth are removed. This nerve is responsible for the feeling in the lower lip. It doesn't affect the movement of the lip, but if the nerve is bruised or damaged, you can have prolonged numbness or altered sensation. The incidence in the literature which suggests that this is a problem in between 1 or 2% of patients. Additionally, there is a nerve that runs on the inside of the jawbone, the lingual nerve, which supplies the side of the tongue. And this can similarly be bruised, but the occurrence of this is about 0.5% of patients have this problem after wisdom tooth extraction. The major risk associated with wisdom tooth extraction is injury to either the inferior dental nerve, the nerve that runs through the lower jawbone, and also the lingual nerve. However, fortunately, the incidence is low, as I've already said. To minimise the risks, it is important that you plan the surgery with the aid of the appropriate X-rays and scans to minimise the risks and optimise the outcome. If the nerve is closely related to the roots of the wisdom tooth, an alternative procedure can be carried out where the top of the tooth, the crown of the wisdom tooth, is removed and the wisdom tooth roots are left behind. Usually bone grows over these roots and they do not cause any further problems, and they resolve the patient's symptoms.